Hi, my name is Heidi, and this is Jenna, and today we're going to demonstrate trans-arterial approach to the axillary nerve block. Peripheral nerve blocks, some things to take into consideration are that we are using local anesthetics. We want to ensure that we have proper placement. We do not want local anesthetic to infiltrate into the vasculature because we all know that local anesthetic into the vasculature can be very harmful to our patients and can create LAST syndrome, which is local anesthetic systemic toxicity. So it's very important that we follow certain steps to ensure patient safety. The first thing we want to do is set up our tray. And so the things on our tray would be, we would want to keep sterility. You'd have your drapes, sterile gloves, your local anesthetic. You'll need some local anesthetic for your skin wheel, and then your other local anesthetic for the actual nerve block. We're going to be using betadine to sterilize the area, and then we want to use a B-beveled needle because this type of needle causes less trauma. We also want a 20 cc syringe that we will use for our local anesthetics. Now that we have our table set up and our supplies ready to go, we want to position the patient and put the monitors on. So we would like EKG, pulse ox, and blood pressure, and get a baseline set of vitals for the patient. We'll continue pulse ox and EKG monitoring throughout the procedure. Once we get the patient supine, we want to abduct the arm from the body, and we do not want to hyperextend the arm because that will impede our flow. So it's important not to tuck the hand behind the head, but just to lay it naturally off to the side here. Then we will take our betadine and cleanse the area and get the patient draped and ready for the procedure. We want to cleanse the area, making circular formations away from where we're going to do the injection. And then once we have the betadine applied, we'll go ahead and drape the patient, reminding the patient to turn their head away from the area. We want to locate the brachial artery and isolate it, following it proximally, which then becomes the axillary artery. Taking your left hand, or non-dominant hand, you would use your index and middle finger to follow the artery as far as you can, with the goal of being able to palpate at the axillary fossa. Once you have isolated the pulse, you want to palpate to make sure that you are on track, because this will be key in where you will place your needle. Once we have isolated our injection site, we will take a 3 cc syringe and we will place a skin wheel of local anesthetic to numb the site. Then we will take our needle and apply a 20 cc syringe, and we will use our needle to inject. All right, so we have cleaned the area, we have draped the area, and we are palpating the brachial axillary, which then turns into the axillary artery. We're going to follow that up close to the axilla. Once we have isolated, we can palpate our pulse. We will use the 3 cc syringe. We'll go just slightly under the skin, instilling our anesthetic to make a skin wheel. Once we've given the local time we will grab our needle using the B-bevel needle. We use this one because it is less traumatic as we enter. And we want to aim a little more cephalad. And we're going to aim straight for the artery, aspirating as we progress. As you advance your needle, the constant aspiration, you will notice bright red blood that appears in your syringe as you pass through the artery. You will gently continue with your catheter until you no longer aspirate blood, and then at that point you will instill 8 mils of local anesthetic. Once you've instilled 8 mils, you will slowly back out through the artery. Continuing to aspirate, you will see placement. You'll be able to verify your placement as you're getting the bright red blood, and then as you back out of the artery, you will no longer aspirate blood. Once you stop aspirating blood, then you will administer another 8 mils of local anesthetic. Once you've completed administration, you will gently pull your needle out, and then you want to apply pressure with sterile gauze. And the purpose of holding pressure to this area is to prevent backflow of the local anesthetic going back through the puncture site that you've just created. So we want to hold pressure there for 5 or so minutes to give the medication time to fill that space and to get to the nerve. So as a review of the anatomy, the axillary nerve block will cover the ulnar, radial, and median nerves, but we still need to isolate and block the musculocutaneous nerve. That has a different approach. So a quick reminder of anatomy: you have biceps, coracobrachialis, and triceps, and our aim is to go along the ridge of the coracobrachialis. We want to take the last 4 mils of our local anesthetic. We want to inject at the site right here where the coracobrachialis meets, straight through until we meet the humerus bone, back out 1 millimeter, and we want to inject the last 4. This will fill that plane with local anesthetic, and in turn will anesthetize the musculocutaneous nerve, which will then give our arm a full block. With your same needle and what is left of your local anesthetic, in this case we're going to be using 4 mils, we now are going to go and block the musculocutaneous nerve. So remembering that the humerus is the bone that runs through the upper arm, you have your biceps, your coracobrachialis, and your triceps. Where the coracobrachialis and the biceps meet will kind of be your landmark. You want to take your needle and place it straight in, aspirating the whole time until you meet bone. Once you tap the humerus, you will retract your needle about 1 millimeter and you'll instill the remaining 4 mils of local anesthetic. And this will fill the plane with the medication in order to reach that nerve. The same procedure will be to slowly retract your needle while aspirating, and then with a sterile gauze, you want to hold pressure to the area to allow time for the local anesthetic to bathe the nerve. So explaining to the patient that the sensation in the arm will change over the course of time. We want to give enough time between the block and surgery time to make sure that it's taken full effect. We can take down our drape, clean up any areas, and the patient can return their arm back to a natural state with assistance. Thank you so much for watching this video.